everybody. Hope you all are fine and enjoying good state of health. Today we are going to start the description of a typical synovial joint. This topic has been divided into two parts. At the end of the lecture on the part 1, the participants are expected to define a joint, define a typical synovial joint and enlist its components, describe different components of a synovial joint, that is bone, articular surfaces, articular cartilage, fibrous capsule, joint cavities, synovial membrane, and joint fluid. And in the end, enlist the accessory articular structures and mention their functions. In part 2, we will describe the remaining components of the synovial joints along with neurovascular supply of a synovial joint and factors stabilizing a synovial joint. And at the end of part 2, we will discuss the clinical implications, especially the osteoarthritis and synostosis. A joint is an arrangement created where two or more than two bones or cartilages come in contact so that a definite relationship is established among them, which provide liberty to grow and may or may not allow any movement. A typical synovial joint is a freely mobile joint having the following characteristics. It has got a joint capsule which binds the bones and surrounds the joints. A joint cavity, which is named as synovial cavity, is lined with synovial membrane, and this cavity contains synovial fluid. Components of a typical synovial joints are bones involved, articular surfaces, articular cartilages, fibrous capsule, ligaments, joint cavity, synovial membrane, synovial fluid, articular pads of fat, articular discs or menisci or labra, blood supply of the joint, nerve supply of the joint, lymph drainage of the joint, and factors stabilizing a joint. And in the last, the movements of the joints, which are described in another video. Now we start with the different components of a typical synovial joint. First, the bones involved in the formation of a joint, such as humerus in the formation of shoulder and elbow joint, and the parts of the bones involved in the formation of the joint as ends of the humerus in the shoulder and elbow joint. Second is the articular surfaces. These are smooth ends of the bones which come in contact to form a joint. They have got different shapes which are well adapted to each other, and they extend from flat to convex to concave. They are covered by articular cartilage. Next is the fibrous capsule. It is a tubular sleeve-like sheath made up of dense irregular connective tissue and is attached at variable distances from the articular margin, where it becomes continuous with the periosteum. It is lined by synovial membrane having perforations for nerves and vessels and protrusion of bursae. The fibrous joint limits the separation or dislocation and restricts movement to an extent. Next is the joint cavity. It is a cavity between the articular surfaces and is filled with the synovial membrane, may be partially or completely subdivided by an articular disc or meniscus. Articular cartilage or cartilago articularis is a thin layer of smooth hyaline cartilage, bluish white glossy, and apparently smooth and moist. Its free surface bears pits and is devoid of perichondrium. The thickness of the articular cartilage varies from 5 to 7 millimeter in larger giants and between 1 to 2 millimeter in older age. The articular cartilage is moldy to cover the articular surface. Hence, it may be thick or thin in the center to provide the maximum congruences designed for the easy movements. It is a wear and tear resistant. That is, it has got low frictional index and is lubricated. It is slightly compressible and elastic. There are no nerves or blood vessels of its own. It is considered to be shock absorber. That is, it can absorb the forces of shear and compression. With advancing age, wear and tear appears in the shape of undulations and osteocytes or bone spurs. Minimal erosions are seen in the healthy individual, but they are present in certain diseases, and these erosion in these diseases are due to changes in the viscosity of the synovial fluid. Synovial membrane or membrane synovialis is a pink and shiny, smooth and highly vascular specialized connective tissue membrane which extends between the articular margins. That is, it lines whole of the cavity except articular cartilage, intra-articular disc and menisci. Synovial membrane folds on itself and these folds extend into the giant cavity. It secretes as well as absorbs synovial fluid. It, it is also responsible for the inflammatory response and removal of the debris. As regards its structure, it has got two layers, a superficial and a deep. A superficial layer is also named as cellular intima and has got two types of cells. Number one, type A, macrophage-like cells having prominent Golgi complex, mitochondria, and lysosome, and are responsible for the removal of synovial fluid and debris. They are also responsible for the inflammatory response. Second type of cell is type B or fibroblastic synovial cells having prominent rough endoplasmic reticulum and are responsible for synthesis of synovial fluid. The deep layer, which is also named as subintimal lamina, consists of loose areolar vascular tissue with lamellae of fibers. The fibers are collagen and elastic fibers. The deeper layer or the subintimal lamina prevents nipping of the synovial membrane during movements of the giant. Synovial fluid is a thixotropic fluid, that is, being relatively semi-solid but becomes relatively more fluid with strain. It is secreted by synovial membrane type B cells. It is pale yellow clear and viscous like egg albumin. It is slightly alkaline at rest but becomes relatively acidic during exercise. It consists of mucin, that is hyaluronic acid, proteins roughly less than 1 milligram per 100 ml, and cells roughly 60 cells per cubic millimeter. The cells comprise monocyte, macrophages, lymphocyte, neutrophils, and synovial cells and fats. Its quantity varies from zero point 0.5 to ml in different giants. Its viscosity, volume, and color vary. It functions as lubricant and prevents erosion. It also provides nutrition to the articular cartilage. As regard the accessory structures, number one are the bursae. A bursa is a fibrous sac-like structure lined by synovial membrane and contains synovial fluid. These bursae are present at frictional points, hence they facilitate the movement. Number two are muscle and tendons. The muscles and tendons which cross the joint and are attached to articular ends of the bones or close to the articular ends of the bone, they help stabilize the joint. To be continued as part 2 of the topic.